say your name and where you're from, and when I call on you, please remember to unmute yourself, then go ahead. So our first question is from Christine Theodorou from ABC Network USA. Christine, you have the floor. Please go ahead.
Hi, I wanted to ask about the New York Times report previewing an open letter to be published by 239 scientists from around the world calling for the WHO to give greater acknowledgement to the risk of an airborne spread of COVID-19. First of all, I wanted to get your reaction to those reports and to see where WHO's research stands in terms of where we are.
Thank you for your question. So we have discussed and collaborated with many of the signatories of the articles that you have mentioned over the last few months. And indeed, we discussed the available evidence that has been discussed in these pieces. And also, we received contributions from many of the signatories of these pieces. We acknowledge that there is emerging evidence in this field, as in all other fields, regarding the COVID-19 virus and pandemic. And therefore, we believe that we have to be open to this evidence and understand its implications regarding the modes of transmission and also regarding the precautions that need to be taken.
Would you like to add something, Maria?
Just to say, thank you, Benedetta. Just to say that yes, we have been engaged with this group since April, when they first wrote to us on April 1st, and we've had an active engagement with them and with many of the signatories on this through different networks. And as we have said previously, we welcome the interaction from scientists all over the world, from many different disciplines. Many of the signatories are engineers, which is a wonderful area of expertise, which adds to growing knowledge about the importance of ventilation, which we feel also is very important. We have been talking about the possibility of airborne transmission and aerosol transmission as one of the modes of transmission of COVID-19, as well as droplet. We've looked at fomites, we look at fecal oral, we look at mother to child, we look at animal to human, of course, as well. And so we are producing a scientific brief on summarizing where we are. We've been working on this for several weeks now, and we've engaged with a large number of groups, epidemiologists and clinicians, IPC specialists, engineers, mathematical modelers, to try to consolidate the growing knowledge around transmission. But we have spoken about the importance of all of the different potential modes of transmission. This is a respiratory pathogen, and so it is important that what we know fits into the guidance that we have, which is why a comprehensive package of interventions are required to be able to stop transmission. This includes not only physical distancing, it includes the use of masks where appropriate in certain settings, specifically where you can't do physical distancing, and especially for healthcare workers. So our focus on the use of masks, of course, is for healthcare workers, and to use airborne precautions where you have those aerosol generating procedures. But we're also looking at the possible role of airborne transmission in other settings where you have particularly closed settings where you have poor ventilation. So we will be issuing our brief in the coming days, and that will outline everything that we have in this area.
Thank you very much, Drs. Allegranzi and Van Kerkhove. The next journalist with a question is Jérémy Lange of RFA. Jérémy, please go ahead.
Yes, thank you so much. Can you hear me?
Yes, please. Go ahead, please.
Thanks. I will ask my question in French, if I may. It's kind of a follow-up of the previous question. Sur cette étude des scientifiques qui parlent d'une transmission dans l'air, malgré tout, est-ce que ce n'est pas inquiétant, cette étude, quand on pense que l'OMS a suspendu ses essais sur l'hydroxychloroquine après l'étude de Lancet qui a depuis été retirée, mais quand on pense que l'OMS a été très proactif sur ce sujet-là, est-ce que sur ce sujet de la transmission par l'air, est-ce que là aussi il n'y a pas lieu de donner des recommandations tout de suite dans un contexte où on est en plein été, en tout cas sur cet hémisphère, et la climatisation fonctionne dans tous les lieux publics, y compris à l'ONU. Donc est-ce que ce n'est pas inquiétant? Merci.
Thank you, Jeremy. Dr. Allegranzi will answer your question.
So I'll answer in English if it's okay. So first of all, I would like to highlight that we encouraged and supported research in this field as well. You highlighted the hydroxychloroquine or the treatments field of research, but we have supported research in this field as well. And indeed, last week, as you may remember, we held an international research meeting where there were active discussions on infection prevention and control and modes of transmission. And our group, together with the experts who are part of it, really highlighted the importance of research in the field of different transmission routes, and in particular through droplets of different sizes, and understanding really what is the relative importance of this. And also understanding the dose of the virus that is needed, in particular in this route of transmission that is the aerosol or airborne transmission. So these are fields of research that are really growing and for which there is some evidence emerging but is not definitive. And therefore, the possibility of airborne transmission in public settings, especially in very specific conditions, crowded, closed, poorly ventilated settings that have been described, cannot be ruled out. However, the evidence needs to be gathered and interpreted, and we continue to support this. Regarding the measures that you were talking about, yes, indeed, we do recommend a number of measures like those mentioned by my colleague before, which take into consideration this possibility. In several of our guidance documents, we do recommend as much as possible avoiding closed settings and crowded situations. We do recommend appropriate and optimal ventilations of indoor environments, and also physical distancing, as you know, and when this is not possible, in areas with community transmission of the virus, we recommend the use of face masks, in particular fabric, non-medical masks for the public. So all of this is taken into consideration in our recommendations, as we previously said.
And just to say a few words about how WHO does its normative work, the guidelines and the standards and the recommendations that we make are based on a process that we've had now well established. And of course, we're constantly improving that process. We're constantly looking for innovations and how we can do better. And when you're in an emergency situation like we are, and when the science is constantly changing on a daily basis almost, you know, we review some days up to 1,000 publications. The average is about 500 new publications a day. So there's a huge amount of new data that's being put out. Not all of it is of good quality. It needs to go through peer review, and that takes time. But we look at preprints, and we look at peer-reviewed publications. We do what's called a systematic review of the evidence. It's also sometimes called a meta-analysis. When you have a large number of studies, you put them together and have a statistical method of trying to see where the evidence is pointing, in which direction. And as you know, every study that comes out is not always in agreement with the previous one. That's how science evolves, till you get a body of data. So you have bioengineers and experts in physics who do experiments in laboratories and come out with that kind of data. Now, whether that exactly reflects what happens in day-to-day settings and clinical settings, we cannot extrapolate, right? So then you have to take ecological descriptive data sometimes from outbreaks that happen in different settings, which may point in a certain direction, but then you cannot always rule out. For example, it may point to the fact that there could have been limited airborne transmission, but it could also be through fomites or other means. And so the body of evidence continues to grow, and we adapt. And so we do what's called a living systematic review. Every week we update the review based on the latest, and there are hundreds of publications now in the area of transmission. And then we have what's called a guideline development group that considers all of this evidence, and many of the scientists who are authors of that, some of the scientists who are authors on that letter are part of our expert groups and guideline development groups. And they then look at the evidence, and then they have to make a considered recommendation. And we take this very seriously. We are, of course, focused on public health guidance. And so any guidance that we put out has implications, of course, for billions of people around the world. So it has to be carefully considered before it is done. So we want to be as fast as possible and adaptive and responding to the new evidence, and at the same time we have to consider the weight of the evidence. And you mentioned hydroxychloroquine, so very quickly, I think, because we don't want to the reason that we interrupted that trial was because the safety of participants was in question because of a publication, which later was withdrawn. But we cannot take a chance, we cannot take a risk with safety of people who are in a clinical trial. And so within a week, when it was clear that there wasn't that evidence, the study then restarted. And as you may know, we completed the hydroxychloroquine arm, and because there's enough evidence now to show that it does not have any impact on mortality in hospitalized patients with COVID. So just wanted to give you an idea of how WHO actually makes guidance, and it's not impulsive, it's not done on a day-to-day basis, but it's a process that continues and will continue, I'm sure, with COVID for the weeks and months to come.